So good morning, all the speakers, and uh, thank you for coming early in the morning. At least एक दूसरे को सुनने वाले कुछ तो लोग हैं. So I will be talking about. See, the aim of doing this instruction course is to help juniors who are coming into private practice and how do they begin their private practice. So I think I found it useful, but we all who are there in the panel are already accomplished private practitioners. So we'll hear it from them. So we all know the advantage of solo practice. We can practice the way we want to be, and we can give personalized private care, which is appreciated a lot by the patients. We also know the challenges, which are financial. You have to meet the statutory requirement once you're constructing your clinic. Admin work eats up a lot of time, and you have to stay up to date. And that's the reason these corporate chain of hospitals are taking over, and doctor colleagues of ours are going in for secured jobs and fixed salaries. But this was an interesting article which caught my attention, which reviewed the residents who were coming out of residency in ophthalmology. And once they were this was published in IGO, and they were interviewed, and almost 50% of these residents said that they either want to have their own practice or want to join their family practice. So despite the challenges of standalone practice, a good number of ophthalmologists are still opting for solo practice. Now, how and where does one begin? So we have to start from scratch. We have to lay down the SOPs, create a proper infrastructure, follow all the statutory requirement from the beginning, play smart and play safe, because we know that we are competing with these corporate hospitals. I think we all know that cataract still remains bread and butter, and two important aspects that we'll be discussing, Deepa will be talking about, and I'll be talking about, is how do we run a successful cataract practice. And it's very important to give your patients a good refractive outcome after cataract surgery, in which biometry is something which is of most importance. So this is what Deepa will be talking about, and then we all know that we have to give multifocality to all our patients, and how do we incorporate these premium lenses, this I will be speaking about. Now, once you begin your practice, how does one raise the standard of care and increase patient satisfaction? This can be done by rigorous accreditation process, which tells you how to follow the statutory requirements and all the things which are patient and the center centric. So Ashish will be talking about the NABH accreditation process. I think doctors are infamous for their handwriting, and there have been a lot of medication errors. So digital prescription is something which is now becoming common, and it increases patient satisfaction also. And along with this comes the advantage of that it's environmental friendly. You save yourself from litigation. The less room is required for record keeping if you go electronic, and there are a lot many benefits. So I think to go paperless is the way to go in future. I think all of you would agree that most of our patients are now opting for cashless facility. We have cashless everywhere facility also by many of the insurances companies. So again, how do we enroll with these insurance companies is again important, and we have to know how to negotiate and get best out of these companies. As doctors, I think we have always been focused on acquiring clinical skills, giving our best to our patients. So we were like horses focused totally on clinical work, and we've been relying for decades on word of mouth to get new patients. And whenever we talk about social media, especially somebody who's not very tech savvy may think that it's an extra work, and it may be simply not cut for us. But trust me, social media is like new yellow pages for doctors. And social media marketing is very, very powerful tool for building your brand, reaching new patients, and growing your practice. And this is what Dynamic Anchal will be talking about. So I think we'll begin with the first topic. Deepa, you can talk about how do we optimize the biometry. Thank you.